Hello, I'm Dr. Brandt Gibson, and today we're going to talk about another nail problem. So yesterday we talked about onychomycosis, which is a fungal toenail. Today we're going to talk about the blackening of the toenails. So a lot of times you'll start to see a nail that gets really black, or it looks like it's got a black spot in it, or something like that. The most common reason for this would be bleeding underneath the nail, or a subungual hematoma. And with a subungual hematoma, they can actually just be bruising of the nail, so it'll look black, but it really doesn't have any pain. Or it could actually be really, really painful, where you injure your toenail or your toe, and it starts to get more and more painful and starts to almost throb, like you can feel your heartbeat in your toe. With a true subungual hematoma that's continuing to get worse, that's throbbing and hurting, the only way to treat it is actually to drain the blood from out from underneath the nail. Now there's two ways you could do that. One would be removing the toenail, which is pretty uncomfortable and usually not what I recommend. The other would be to actually put a hole in the nail itself. Easiest way to do that is take a needle of some sort and heat it up, and then just twist it through the nail. It usually goes through quite easily. If it's warm, you could actually do it. It will actually go through almost like it's going through butter. And then the idea is you'll start to see blood coming out of the nail. In the worst cases that I've seen, with a subungual hematoma that's really, really tender, you puncture that nail and then the blood actually spurts out to the point that it could shoot to the roof or to the ceiling and without a problem, because of how much pressure is built up underneath that nail. The advantage of that is immediately once you start to drain it, the pain goes away. So that throbbing, that aching, that pain that they have in that area can actually dissipate really, really quickly. Now, there are other reasons why you could have black spot on the nail or a black area in the nail. One such reason, for example, would be a subungual melanoma. So you can actually get a form of cancer underneath your toenail. Although that's not common, it's something that you should be at least concerned with. What we usually say is as the nail is growing out, it's staying the same place, or if it's changing shapes or sizes or appearances, then you do want to get it evaluated and probably biopsied. Most of the time we'll end up removing the nail so we can actually biopsy that tissue and send it off and ensure that it's not a melanoma in that place, which can be a much bigger problem. The most common reason you'll have blackening of the nail is because you've injured it in some way and you have bleeding or bruising underneath the nail. And we call that a subungual hematoma. So if it doesn't have any pain, and it doesn't look abnormal that would cause us to feel like it could be a melanoma, most of the time you don't have to do anything for it, just protect it. And over time, the nail will grow out, the blackness will go away. It may take up to a year, but you'll end up trimming it off just like you trim your normal toenail. This is Dr. Brandt Gibson, and this is your Podiatry Tip, day number 10. And tomorrow we will do a little bit more on nails, I believe. Yes, tomorrow it is onychodystrophy, which is other reasons why the nail would not look normal. So we'll actually discuss some of these other reasons tomorrow. So have a good rest of your day. Again, this is Dr. Brandt.